And then coming to trauma, we discussed trauma a couple of days back. Trauma to the esophagus is not very common, but sometimes people with vomitings, retching, especially in hyperemesis gravidae and pregnancy-related vomiting, they have a lot of retching, which causes increase in the intraesophageal pressure and causing tear in the esophageal mucosa, causing a trauma-like picture, and patient may vomit blood. That's what we classically call as Mallory-Weiss tear or Mallory-Weiss syndrome. Patient will come with hematemesis and they rush to the emergency, and when we do endoscopy, we find some vertical tears in the esophagus. That's what we call it as Mallory-Weiss tears. And sometimes people who are receiving radiotherapy for some cancers anywhere, so the esophageal trauma injury can also be secondary to the radiation therapy. And of course, road traffic accidents are very rare. Injuring this, if it is a cast road traffic accident, polytrauma, a fracture of the ribs and all, we may also get esophageal injuries, but they're very rare road traffic accidents. And corrosive poisonings, people who are at deliberate self-harm, they want to commit suicide, they may drink some acid or some kerosene or some other corrosive substance. This can cause trauma to the esophagus. Sometimes esophageal rupture, esophageal perforation also can take place. And another very common problem, capsule esophagitis or tablet esophagitis. Nowadays, many times we have the big tablets like the metformin, anti-diabetic drug is available in a big size capsule. And that's why nowadays the metformin also is coming in a small, so the medical company representative, they come and say, sir, we have reduced the size of the capsule, size of the tablet. So capsule esophagitis also, sometimes if the patients are able to swallow, but in while they are swallowing, the capsule can cause small minor trauma, causing capsule esophagitis. So this is also known. Tablet esophagitis or capsule esophagitis is again another entity. Again, foreign bodies, especially pediatric people, when they swallow foreign bodies, it may get stuck in the size. Usually coins, they get stuck to the esophageal wall and they may rupture. Patient may have bleeding. So these are the various modes of trauma to the esophagus. Sometimes the food impaction. Sometimes we are eating some hard food um, like your nuts or something. It may get stuck in the esophagus, and while passing through the esophagus, it may rupture the esophageal wall, and you may have bit of bleeding. So these are the trauma-related esophageal disorders like Mallory-Weiss tear, radiation, accidents, corrosive poisoning, capsule, foreign body, and food impaction. Similarly, we have tumors. We have tumors in the esophagus. As we were talking yesterday, people who smoke a lot, people who drink hot coffee, even chronic alcoholics can have these tumors of esophageal tumor. Esophageal tumors are more common in the lower one-third of the esophagus. That's the site. And the incidence is five people in 1 lakh population. So that's the incidence ratio. And adenocarcinoma is being the commonest type of cancer which occurs in the distal esophagus. Smoking, alcohol, sometimes virus infection also is found to be the cause of these cancers, especially the human papilloma viruses. And we also have some infections, other infections, which can lead to esophageal malignancies. And infections, of course, any infection, most commonly viral infections, especially in immunosuppressive patients like HIV and post organ transplant patients will have some infections of the esophagitis. And similarly, patients who are on chemotherapy or radiotherapy, they can have infection. If the chemotherapy and radiotherapy, they cause the damage to the esophageal wall and the inviting the bacteria to invade and cause infections, inflammation of the esophagus. HIV, of course, AIDS and HIV is very well known to cause infections, and especially the fungal infections are very notoriously known to cause esophagitis in immunosuppressed, immunocompromised patients. When you come to fungus, if you take the culture of the oral cavity, normal human, everyone, you and me, we harbor the some fungi in our mouth, which is Candida, especially Candida albicans. But the same fungus cannot go down because of the immunity barriers that natural barriers that we have. The natural, normal, physiological bacterial flora of the oral cavity will have fungus, Candida. But same thing if it goes down and it will attack the esophagus, because the esophagus has no capacity to fight the fungal infection, fungi. So you have fungal esophagitis. So esophageal candidiasis, that is the term that we use, esophageal candidiasis. So how to diagnose? Patients come with difficulty in swallowing or retrosternal pain, and when you open the mouth, you may see white patches in the oral cavity, in the palate or on the tongue or something like that. So if you really do an endoscopy, these patients, you may find the esophageal candidiasis also. It is easily treatable, of course. You have to treat for about 2 to 3 weeks with antifungal agents. Candida albicans is very commonly occurring fungus. So in viruses, herpes virus can also cause herpes-like lesions in esophagus. Similarly, we have cytomegalovirus. Cytomegalovirus also can cause viral esophagitis. So infections of esophagus are little rare. So how do you diagnose? Another thing is systemic infection, systemic diseases like your connective tissue disorders. Connective tissue disorders, especially if you are talking about scleroderma. Scleroderma is, it can be cutaneous, it can be systemic. Cutaneous scleroderma, systemic scleroderma can involve any part of the internal organs, including your esophagus. So systemic sclerosis can also cause involve the esophagus, and the esophagus also will have sclerosing type of obstruction, dysphagia, and all those things. And there are certain dermatological skin diseases that can have secondarily affected esophageal diseases like pemphigus and Behçet's and other things. So all these esophageal diseases, the complaints is either retrosternal pain, difficulty in swallowing, GERD like symptoms, regurgitation, reflux. So GERD is a common denomination for complaints for all these patients that are coming to you with esophageal related diseases.